Agenda has a critical role to play in breast health. And while we encounter women on a journey that begins with the diagnosis of an illness, we are really focused on how do we get the very best information about that specific disease so that treatments can be tailored, they can be timed, they can be adapted specifically to that cancer for that particular woman that will allow them not only to have the confidence, the comfort in their daily lives, but that each woman can have the information so she and her physicians can make the best decisions for the best health and outcomes for the rest of her life. This is not just about treating a disease. It's about making sure that we go through this phase and we return these women to a healthy, happy, and very satisfying rest of their life. The first thing that we're looking at with the MammaPrint test is what can we identify about this specific signature that gives us an indication of the potential for this cancer to recur with a distant metastases. And this is one of the fundamental questions that you want to answer very, very quickly when you're treating any kind of cancer, but specifically in breast cancer, because this is where you get the first information of the risk of a recurrence of metastases that ultimately can affect long-term survival. MammaPrint and the data that has been established through our landmark studies shows that this is a diagnostic tool that can be used for women of all ages and at all diagnosis points in early stage breast cancer. Blueprint allows for a very specific understanding of the underlying biology that can provide insights where, for example, you may see a tumor that has a much higher risk that needs to be addressed than what your fundamental clinical evaluation of the patient may tell you. The combination of MammaPrint and BluePrint give you an understanding of when or not a patient, whether they're premenopausal or postmenopausal, needs to have chemotherapy, but also helps to inform critical decisions of other long-term therapies. Ordering a MammaPrint and BluePrint at the earliest stage of diagnosis means that women who are on this journey with their providers and have all of the information they need to make the best treatment decisions as soon as possible.